And I think we can go ahead and get started. So again, welcome this evening to Nebraska Medicine's Medical Assistant Virtual Career Fair. Just as an overview of our agenda, again, we'll have some current medical assistants who are employed with Nebraska Medicine, and they'll share their journey of what it took for them to become a medical assistant and why they chose Nebraska Medicine as an employer. And then we also have our medical assistant managers or our clinic managers discussing with you a little bit more information about their clinics to pique your interest in all of our opportunities here at Nebraska Medicine, but specifically we are highlighting several clinics tonight, and they'll share what they're looking for in candidates. And then I'll share with you overall some of our current opportunities that we have and how to apply, and then the application process. And then in the end, we'll address any questions that you have, and we'll have a prize drawing. First, I do want to introduce you to our clinic culture, our culture within Nebraska Medicine and our Nebraska Medicine values. So we just have a short clip here for you to learn a little bit more about being a part of the Nebraska Medicine family.
One of those things I observed immediately was nobody seemed really cheerful. Like it was a very serious demeanor when I walked in. And I'm used to working in clinics and settings where, you know, we joke and we laugh and everybody's pretty happy. It was like everyone was very serious. So I didn't know if that was because I was new and they just didn't know how to take me or if this was just the culture of the environment. And as I got to be here a little bit longer, I found that it was the culture. One of my other nurses, as they were going through this work, came to me and said, what if we created an employee engagement committee? I decided to send out a survey to all employees and say, what would you like more of? What do you want less of? And what can I count on you to be accountable for to improve the culture in our clinic? And with getting that feedback, we had a staff meeting. I didn't give names. I just gave what the themes were and what people gave as feedback for more of, less of. Kept the accountability piece to myself, and then I broke them up in groups and separated them all away from their friends or who they would normally be with for us to have some discussion and see what are the top 5 themes that you see or what do you feel is important. And that's where I feel like we really started to see a shift and change, because out of that we created our code of conduct. We thought it important to display our values at all times. So I always find opportunity in coaching of where we failed on our values as well as our code of conduct to bring them back into the circle of here's what our commitment was, here's the expectation, tell me how you're going to follow it. You always ask an employee why they're leaving, and one in transparency had told me that they were leaving because they wanted to grow and they didn't feel like our clinic had the opportunity. But once they left, I had quite a few team members come to me and say that they said they left because we didn't have any teamwork and we had drama. And so my question to them was, do we? Do we have a lack of teamwork and do we have drama? Because I can only do so much, right? I'm out there, I'm leading by example, I tell you my expectations, so what's happening when I'm not around? And that's when we really started to dig deeper into this work, and everybody was committed because the people that were left felt like, you know what, we do have good teamwork, we don't want any drama, and we do have a good team, and we're going to make this be a place where people enjoy coming to work and they want to stay.
She gave us these handy little cards here, the I Teach values, and she said basically these are the 6 things that this clinic is based off of, and with that came like no cell phones, so we could be in the now, and I've seen that that has really made a big difference.
Everybody's more relaxed. I think things are quieter. I think we're more efficient. Everybody in the clinic seems to be taking more responsibility for getting the patients in, getting them roomed, and supporting them.
I would say Previously, very serious, very focused, very one channel. Now, fun, happy, great conversations going on with the patients as well as team interactions. Just very, I'm here to check you out. Let me get you checked out. Let me get you checked in. Now it's, hi, how you doing today? How'd your appointment go?
I've seen big change in everyone and everyone stepping up to the plate. It makes me feel positive, makes me want to come to work every day.
And the patients have said it. I have several patients that have asked for me to come out front. You know, when you have that request, you take a deep breath because you never know what you're walking into. But most have been that they've been coming to this clinic for quite some time, and they're very happy with the changes that they've seen in our clinic. So that speaks volumes to me, because that's not me, that's the staff.
All right, so that just gives a little bit, a peek into the culture of Nebraska medicine, and I love that it ended on our I Teach values that focuses on innovation, teamwork, accountability, excellence, courage, and healing. So you'll definitely get a little bit more as each member of our team speaks tonight. This slide just gives you a little bit of an overview of our clinic locations. We do have 16 different ambulatory clinics throughout the Omaha metro area. Also includes clinics in Elkhorn, Grand Island, Bellevue, La Vista, and again throughout the Omaha metro area. So we had a question about, you know, where are our opportunities and our clinics, and so this just gives a little map of it, and then we also have more information on our website at nebraskamed.com. And then you'll be able to actually look into each clinic, see what services they provide, and it gives a little synopsis of each as well. So I think we're going to get started into our conversation with each medical assistant, starting with Amanda Gekas, and she is a current medical assistant at our dermatology clinic located at the Lauritzen Outpatient Center. So welcome, Amanda.
Hi guys, so my name is Amanda. I am a medical assistant with dermatology. I've been there for 2 years now, and I chose to work at Nebraska Medicine just due to the culture and the experience it allows you to build for yourself. I will say my clinic, we do laugh a lot almost every single day, and we are truly one big, not blood-related family, but we do hold each other very accountable and encourage each other to hold up to our highest standards on a daily basis. And Nebraska Medicine does show just every single day, just, you know, true passion and extraordinary care. So with dermatology, we are really into skin, nails, and hair. So with that, we do specialize in Mohs, which is micrographic surgery, this is the removal of invasive skin cancers. So there are 3 types that we really do focus on, and it's squamous cell, basal cell, and all stages of melanoma. We also do veins, lasers, and cosmetics and general dermatology. So with that, with the medical assistants, we are the first point of clinical contact with our patients in office. I help educate patients on a daily with current and upcoming procedures. I help with treating chronic skin conditions and assisting the dermatologist during surgeries or quick biopsies, cosmetics and lasers. We also do take part in administrative duties and reminders for patients to do lab works or any results that need to be relayed to patients. So yeah, that's a typical day with being in dermatology.
Thank you for sharing, Amanda. I'm actually getting excited. I can't do what you do, but I love hiring passionate individuals and especially linking people with their interests. And so that's actually interesting to me. So thank you for your time. We may have some questions for you later.
Okay,
All
perfect.
right. Our next speaker is Chaz Barboza, and he is a current medical assistant at the Chalco Health Clinic. Welcome, Chaz.
Hello, my name's Chaz, medical assistant, obviously at Chalco. I'm part of our family medicine clinic, and I've been with the Med Center for 13 years now. The thing that drew me to the Med Center was the clinic that I was lucky to precept at was located down in Plattsmouth, and it's just the family culture of the Med Center. Everybody kind of comes together. There's people that I can call all over the Med Center, and I just really appreciate all the relationships and stuff that I've developed with the Med Center over all these years. And it's definitely one of the biggest selling points of being employed by us. It's just all the camaraderie that we have. And Amanda actually has come out to our clinic. Dermatology comes to our clinic at our family med clinic. Well, they did prior to COVID. And then we do have a bunch of other pieces that come out to our family medicine clinic for like psych does come out there now, as well as we have a pharmacist, a social worker also that do come out there. But for our clinic, our typical daily flow, we do kind of keep the clinic flowing. That's our job. We help our doctors keep up with their patients, make sure that they stay in a timely fashion, help out with filling in some blanks in paperwork at time. We do a few procedures at our clinic. Dr. Marcellin likes doing injections and things like that. Sutures, he really enjoys doing just kind of little minor office procedures, and we do assist with those as well. And then we do lab work, injections for school physicals, immunizations for kids. We also try to make sure that we have records and stuff prior to make the visits kind of go a little bit more smoothly. And again, we do schedule a lot of appointments for outside things like MRIs, CT scans, other visits with other clinics, which again, just developing those relationships with people, which is what I've been enjoying for these last 13 years. So thank you kindly.
Thank you, Chaz. And I also had the opportunity to kind of shadow Chaz when I was learning a little bit more about the medical assistants in order to recruit the right candidates for Nebraska medicine. And Chaz had me running all around following him, but it was a great experience just seeing how he interacted with the patients. And, you know, you do see those patients over and over, so you become quite acquainted with them, and just helping all throughout the clinic and working with the team, like you said, the nursing staff, the providers, the medical receptionists, all of that just functions so smoothly as a team. So thank you. All right, our next speaker here is Caitlin Neeson, and she is a current medical assistant for our family medical clinic at the Durham Outpatient Center. And we've also invited Caitlin to speak tonight as well to talk about her journey of becoming a medical assistant and a little partnership that we have as part of our medical assistant sponsorship, where anyone who is not currently a medical assistant but who wants to become a medical assistant in Nebraska medicine, we actually provide opportunities to sponsor them going through school, getting their clinical hours, all while being employed with Nebraska medicine. So welcome, Caitlin, and I can't wait to hear about your experience.
Hello. Hi, guys. My name's Caitlin. I have been working as a medical assistant for Nebraska Medicine for about a year. Overall, I have been working for Nebraska Medicine for almost 5. I had started as a medical receptionist and was given the opportunity through the sponsorship program that she had just spoke about. And I had gotten a scholarship to complete the program through Metropolitan Community College to become an MA for Nebraska Med. It was a journey. School was different at that point, but it worked out really well. I hadn't been in school for 8 years, honestly, and the program and the guidance that you get through all of it worked out really well. I have been working in the family medicine clinic now for about a year. I've been given the opportunity to work with a lot of different providers throughout our clinic. Every day is completely different. We see all of our surrounding community and we get to help provide all of them with their care. The more time that I have spent in family medicine, I get to see families literally grow. I have seen women starting their journeys into motherhood. I get to see them come in for other OB checkups, and then suddenly now they're bringing in these tiny little babies for their first week out of the hospital for their first checkups. I've gotten to see people come in for their follow-ups after being hospitalized, getting to watch them through their journey to recovering from their ailments that put them there. We see patients once a year for just their regular annual checkups, and you can really see how important their providers are to them. These patients are drawn to their providers, and these people are giving them the best care that they possibly can. They've known them for years, and now you have become part of that team, and you're there to treat whoever they are whenever they need. As a medical assistant, we're also working with providers during procedures. I've seen lots of different like OB procedures, toenail removers, joint injections, cyst drainage, mole removals, you name it. Anything fun, exciting, kind of gross. I mean, we get to do it, and it's always safe when we do it here in the clinic. A normal day, we're setting up for the day ahead and we're having a game plan. And then throughout the day, we're rooming our patients, setting up for procedures, assisting during them, giving vaccinations, doing phlebotomy within our clinic, and our patients are just all around. We're being kind to those around us so that they know they came to the right place to be seen. Not only are those relationships that you're building with patients and providers, all the other MAs, the PAs, nurses, providers that are there, but we're also building relationships with the other people who are there to support us. We have like our food service and environmental staff. You see them every day. If you're ever to go to get a lunch, a snack, a soda, water, whatever you need, you see them there. You always want to just say hello. They're working there to help just along with everybody else who is ever in need. I love knowing that walking through the halls, I'm able to keep my head picked up just to make sure that I'm able to tell all those people hello in the hallway when I see them. Nebraska medicine is known and respected all around when it comes to medical care, not just here in our community, but within the people. They know our hospital's name nationally. So many people have traveled from over states to receive their care and treatment with us. It's a good feeling to be able to tell people that I'm a medical assistant at Nebraska Medicine and that they have done a lot to help me to grow and become a medical assistant. I am now confident in what I am doing for this community. I just want to say thank you all for listening, and I really am excited that you guys are here to become part of the medical assisting world.
Thank you so much, Caitlin. I love hearing your story. That's the first time I've heard that you started off as a medical receptionist. So that is great, and I appreciate your time tonight. Just a reminder, we do have that Q&A function. I see a few questions coming in, but I just wanted to remind everyone to submit any questions through the Q&A function, and we'll address those at the end. So I do want to introduce the next speaker as a clinic manager. Again, for dermatology, we have excellent medical assistant from dermatology, and now we have the clinic manager to talk about the clinic overall, and again, what she's looking for in candidates if you're interested.
Thank you, Alicia. Hi, everyone. Welcome. My name is Tiara Robinson, and I manage the dermatology clinic at the Lauritzen Outpatient Center. Dermatology is very unique because we're one of the newer departments to the organization. We started seeing patients almost 2 years ago, and we just see a wide variety of conditions. You heard from Amanda, who is one of our highly functioning medical assistants, who really gets to see what we do on a daily basis. She mentioned some of the common conditions that we see, as well as we are operating a fully functioning vein clinic. We just hired a new director of laser and cosmetics. And so we are just able to really help patients who are extremely sick. Some patients come in with some pretty severe and intense conditions, and we really take pride in taking excellent care of those patients. For our medical assistants, they do everything from assisting the physicians with procedures, as well as rooming patients, all of their demographics and information. It's a very on clinic. No day is ever the same. We have physicians who are extremely patient and passionate about teaching. And so just lots of operating at the very top of the medical assistant scope. What we are looking for in candidates is really those who are willing to come in, work hard, have fun while doing it, and just really become passionate about patient care and dermatology and just learning everything that there is. Amanda kind of touched on our clinic really being this family environment, and she is right on. We have very close relationships. Outside of COVID, we get together outside of work and just have a really good time with each other and our families. And we just take a lot of pride in building a really tight-knit family while at work. Dr. Wysong is our medical director. She is extremely passionate and engaged. She is currently recruiting additional physicians. And so we have a lot of opportunities for growth and just a lot of learning opportunities within our clinic. We currently have several medical assistant positions open due to our growth. And so I am just excited about you guys participating tonight, and hopefully you will find a lot of interest in Nebraska medicine and dermatology. So thank you guys for being a part of this.
Thank you, Tiara, for being here tonight. And again, we definitely have some opportunities within dermatology. So if you're interested, we'll talk about how you can apply to Tiara's team. All right, and next we have Jill File, clinic manager at the Chalco Health Clinic.
Hi, good evening. Thank you everyone for joining. Like she said, I'm Jill File. I'm the manager of the Chalco Health Clinic. I work with Chaz on a daily basis, but I'm also here to talk about a different opportunity that I also have available with the float pool. So recently we started, it was in October, we started what's called an ambulatory resource center. And now we have medical assistants that are going to be floating between our 14 primary care clinics. This is a relatively new concept. In October, we started with medical receptionists. So I currently have medical receptionists that are floating amongst the clinics, but the medical assistants would be new. So I do as well have several positions open for that. It's kind of a unique opportunity because you would get the same experience that Chaz and Amanda and Caitlin are talking about, but you'd get it in several different environments. So it would be the same rooming process, giving meds, injections, drawing blood, rooming patients. It would be all those same responsibilities. You'd just be doing it at different locations. It's a unique opportunity to build a network across Nebraska medicine. So you'd be working with people like Chaz and Amanda, and you'd get to meet so many different medical assistants and so many different others across the organization. So really a cool opportunity and just a chance to build something from the ground up with me if you'd be interested. What I'm really looking for, I think that one of the biggest things is flexibility, since you are going from place to place, and really having that personality where you want to meet new people and learn new things and do different things every single day. I think that's incredibly important in this role. And then obviously to be really accountable and self-motivated, because I think sometimes when you go to the same clinic day after day, you know that your manager is always there right by your side. And this would be a little bit different, where we would talk over the phone via text message or phone calls or Zoom meetings just like this, or I would come out and visit. But it's really one of those things where you would be out on your own visiting different clinics. So yes, that's what I have to offer.
Thank you so much, Jill. Definitely a great opportunity for you to see different areas of the hospital. Again, like Jill said, make connections with different providers, different staff, really just build up a wealth of experience and knowledge in one position, but obviously at different clinics. So thank you, Jill. And our next manager is Danny Lamer, clinic manager at Heart and Vascular Clinic at the Durham Outpatient Center. Welcome, Danny.
Hello, everyone. So excited that you could join us today. Like Alicia said, my name is Danny Lamer. I'm one of the ambulatory supervisors at the Heart and Vascular Clinic and the hiring manager for our medical assistant position that we have open. At the Heart and Vascular Center, we cover everything that you can think of if it's heart related. We have multiple specialties within our clinic. So we have general cardiology, electrophysiology, heart failure, adult congenital heart disease, vascular. We see LVAD patients, CT surgery. So anything heart related is where you come to us. We have locations both at the Durham Outpatient Center, Oakview, which is on 144th and Center, and then out of the Bellevue Medical Center. We are looking to fill positions at the Durham Outpatient Center currently, so at the main hospital. A little bit about our clinic and what we're looking for. So we're a very busy clinic. In our general cardiology specialty alone, we have 20 providers that rotate through our clinic, and that's just one of our specialties. So we are very fast-paced, looking for someone that can keep up with that and who is very self-motivated. We are very much a team-oriented clinic. We work with the providers, nurses, MAs, patient coordinators, everyone that's in the clinic works together to make sure that the patient gets the best experience possible. Our providers are also very motivated to teach. They love explaining why they're doing a certain procedure or why they made a certain decision to not only the nurses, but the MAs, anyone really that's willing to learn. They are willing to teach. Along with that, a lot of our MAs have taken the opportunity to shadow procedures. We've had MAs shadow during a heart transplant, during heart catheterizations, which normally those aren't performed in the clinic, but our providers are so willing to teach that they invite MAs to come into the OR or the cath lab and see those procedures performed so that they're more knowledgeable and can educate the patients on those procedures. We're also looking very much for a team player. Like I said, we're very busy, so we are very self-accountable, but also rely on each other. If someone's getting behind or a provider is running behind, just to make sure that we can all help keep each other on time, keep the patients happy, and get everybody through the clinic. Also, our MAs are the front line, as was stated previously. So a lot of our patients come in regularly for checkups, so they recognize the MAs, they form relationships with the medical assistants. It's really great to watch when a patient walks in and just lights up because their favorite MA is coming to grab them. That's one of my favorite things that I see when walking through the clinic is the relationships that are built between our staff and our patients. We are also a growing clinic, so we are looking for someone who is willing to grow with us. We have 4 providers coming on within the next year, and I know we're actively recruiting more. So very much a growing clinic. We're gonna stay busy. And someone who's looking to learn. We also have opportunities to join subcommittees within our clinic. And as stated previously, we will do things outside of work like other clinics will. We have an engagement committee that plans things for not only our staff, but their families to go to. So overall, we're just very team oriented, very excited to get new people on the staff. I believe we have 1 position open currently, but I think due to our growth, we will be adding a 2nd position here shortly, or we're gonna try to get one on there shortly. But overall, we're just very excited to have everyone, and I'm glad that I had the opportunity to share my clinic with you. So it's good talking with everybody.
Thank you so much for joining this evening, Danny. And you really hit on a couple of things that I'm marking down, just those subcommittees. So opportunity for medical assistants and any staff within the clinic to just take on some more responsibility that they're interested in. So subcommittees, and then also shadowing in procedures and being in the OR. I think that's a great opportunity and a great highlight that you shared. So thank you for that. All right, so our next slide is our clinic manager, Megan Armbrust, at the pain clinic at Village Point, and she also has a clinic on main campus. So welcome, Megan, and I'd love to hear a little bit more about your area.
Thank you. My name is Megan Armbrust. I'm the manager for pain clinic at Village Point, as well as neurosurgery and physical medicine and rehabilitation. First, I'll talk about pain. When you think of pain, you probably think a lot of medications, and we do procedural-based pain relief. So we are providers. We have 5 providers and 1 physician assistant who do injections both in the clinic and in the procedural area. Some of the injections we do in clinic are trigger point injections, knee injections, bursitis for hip injections, and we do Botox injections for migraine therapy. So our staff not only do the rooming responsibilities that everybody else has talked about, if there's any positioning help or anything needed with our injections, our staff also help with that. Our pain clinic, we have the main clinic is at Village Point, but we also have a clinic for pain down on main campus in Clarkson Doctors Building North. And then we have a clinic at Bellevue Medical Center. And then we also are at Brentwood Clinic, which is a family medicine clinic. We just use their space 1 morning a week. So we have a lot of opportunity to see a variety of areas, but still work with the same providers. Our neurosurgery clinic is on main campus, and then we also have clinic time out at Village Point. So we also are traveling again, just 1 day a week there. And just like everybody else has said, I think it's a big thing with the culture of Nebraska medicine that providers are just so willing to take a moment and kind of teach and explain things, especially with some of our more interesting CAT scan and MRI images that come in. Our providers are very willing to stop and kind of explain things to everybody. And I think one thing that we are looking for, just to echo everyone else, is self-motivated, especially being at the different locations. It's easy to kind of just fall into kind of a rut. And so we're looking really for people that can stay self-motivated. You can be a team player even if you're not at the same location. And then just always assuming positive intent of each other, even though you're not at the same location, just always assuming the best of each other. And that's it.
Thank you for sharing, Megan. I love hearing about that as well, just the different opportunities to still work with the same providers, but just knowing that you're all over the community and helping the patients, and it's all about the services that we're able to provide to our patients. So again, it goes back to the Nebraska Medicine I Teach values: innovation, accountability, excellence, courage, healing, and number 1, that teamwork. So thank you for being here tonight and talking a little bit more about your area. All right, so next, just a little bit of information again about how to apply. So I am hoping that this evening the speakers and everyone has piqued your interest and inspired you to become a part of the Nebraska Medicine family. So again, the way to put in an application is by going to our careers page at nebraskamed.com/careers. On that website, you'll see a lot of medical assistant listed, and each one should also list the area right off the bat so you know which area you're applying to. You can read the description and it will give a little synopsis to the position highlight or a little bit more about the clinic. And you can also apply to multiple clinics. So if several interest you and you just want to know a little bit more information about each clinic, you can definitely apply, and I would be the one reaching out to you to share information, go over details. Again, really see if we can make that connection and connect you with the best opportunity with your background, with your interest. Also, a part of that application process, we do have you go through an assessment. That assessment is about 50 questions. It may take about 20 to 30 minutes for you to go through those questions. It really just gives us a good idea of some qualities that you bring to the table. So some soft qualities, such as your ability to problem solve, work within a team, work with the leadership, and your interest in continued growth and innovation. Also bringing ideas to the table, and making suggestions of how to operate more efficiently or just how to do something differently. So we welcome all of that. Let me see. I'll answer any questions that you might have around the application process, but we do want to address some questions that have come in previously, and we'll get to those questions posed in the Q&A. Again, this is also your time to add any additional questions. Anything specific, we will probably take offline and address those individually, but we want to address as many questions as possible to get you to the point where you're applying for one of our positions. So we did have a question come in about how do you become a medical assistant? And so we do recognize that some participants may not be current MAs. You may have your CNA, you may have your LPN, you may have some other certification or just a general interest in being a part of the medical field. And so we do have our partner, Tim LaRue, who is a part of the Clarkson College and provides great assistance for anyone continuing their education. Hi, Tim.
Hi, everybody. So my name is Tim LaRue. I'm the Assistant Director of Professional Development through Clarkson College. And I'm here today to kind of get you motivated to learn to become a medical assistant. So there's a partnership right now between Nebraska Medicine and Clarkson College that we help sponsor some people to become medical assistants. And I'll leave Alicia to discuss more of that program. But through that program, it prepares you for the CCMA exam. That's the Certified Clinical Medical Assistant exam. So once you get that exam, you get your CCMA, and then that is good for a couple years where you do continuing education and continue your licensure there. I see the other question here, how would I go about recertifying my license? If you are a lapsed CCMA, it is an exam-based certification, so if you did not meet the criteria to submit your continuing education, you would simply have to challenge the exam. It's a 150 question exam, you have 3 hours to take it, and that's the same exam that you would be taking if you were to be starting fresh. So you may need a refresher, you may need some study materials. That's a little outside of what Clarkson College is offering here. We're offering an online version of a class that prepares you for that exam, and it also includes about 130 hours worth of clinical time, which is spent in a lot of these clinics with the clinical managers that you've been hearing from today. So it's a great opportunity to get your foot in the door. There's other opportunities to not only just get your medical assistant, but through the recruiting office, maybe find other avenues to start working, get some money in your pocket while you're going through classes online. So that's everything I have for you. I'd be happy to take any questions through the Q&A, but I'll hand this off back to Alicia.
Tim, we did have one question about credits. If somebody has credits from another college, would Clarkson accept them?
Unfortunately, no. The program is a package program, and it's all online through a company called Career Step that we partner with, and they provide the education start to finish, and we help provide skill sessions, skills training on site in Clarkson College with our instructor staff to prepare those students for their clinical experience at Nebraska Medicine.
Thank you. And then how often do your programs start?
Right now, we are currently in a cohort, and we will be starting another program hopefully in the beginning of next year. And like I said, Alicia can handle some of those questions as far as when the group is getting together. I'm here to just share that we have this program available, and if you need to get your foot in your door, any other way, we do have like CNA classes available and also take care of some of your other professional education like life support classes.
Thank you.
Thank you, Tim. All right. Does an EMT license and or previous experience in an ambulance help qualify for a medical assistant position? So for Nebraska Medicine, and you'll read this in our job description, you do have to have completed a approved medical assisting program in order to qualify as a medical assistant for Nebraska Medicine. So hopefully that addresses that question for you. All right, does it matter if I was a medical assistant in a different state? Is there an option to work from home? So I'll address the first question, and then I'll see if any managers want to address the second question. As far as a medical assistant in different state, again, as long as you have completed an approved medical assisting program, we accept any and all. I have hired several, especially during COVID, as far as people relocating from a different state and being interested in being a part of Nebraska Medicine. So we definitely encourage and welcome anyone who is a current medical assistant, no matter where you received your certification.
I can talk about the virtual work. In specialty care, especially like pain and neurosurgery, we had not relied before coronavirus on telehealth. And so we are really using our staff in clinic, not virtual, but in clinic, to really help our patients, our providers, everybody kind of grow accustomed to telehealth because it is here to stay. So we have everybody come into clinic. We don't have anybody working from home. Our patients, sometimes our staff have been on the phone with patients for 30 to 40 minutes, just helping them get all of their accounts set up to be able to do telehealth. People wait 8 to 10 weeks to see some of our neurosurgery providers, and so we really want to make sure that they can still connect with our providers.
Absolutely. Thank you for addressing that. All right. Do you have any positions working in trauma or urgent care? So again, I think we mentioned that we do have the immediate care clinics and medical assistants are needed as well. And that is for our immediate care clinics who provide service and care in the evenings and on the weekends. So we occasionally do have some openings. I don't think I have any openings right now, but that can change. But those clinics are open from 6 p.m. to 10 p.m. Monday through Friday, and then Saturdays and Sundays for certain hours, I believe 10 a.m. to 8 p.m. So we do occasionally offer that as well. And what are typical hours for a clinic medical assistant? All of our clinics are open from 8 a.m. to 5 p.m. and your hours could vary throughout the day, just staggered shifts, but it's an 8-hour day and you could be asked to come in as early as 7:30 to just help prepare before the first patients are coming in and stay as late as 5:30 until the last patients leave. So thank you for that question. All right, so it looks like those are all our pre-submitted questions. I have my colleague Erin, if you have any questions in the Q&A that we can address.
Yes, there are a couple, and some of them were addressed in the previous questions, so thank you for that. But one of the questions we got was, if they're working through the medical assistant program, is there an opportunity for work while they're finishing their schooling?
Absolutely. So, yeah, go ahead, Kayla.
I was going to say, I was working full-time for ENT as the medical receptionist. And then I had gotten the option to drop my hours. So I wasn't working full-time completely. I did get a second job, again, sponsored through Nebraska Medicine, to keep up my 40 hours a week, and got the time off through my clinic to finish my schooling and get everything done that way. So there is a chance that you can still work full-time and be in full-time school, and Nebraska Medicine is definitely willing to help you.
Absolutely. Thank you. Yeah, we're definitely very supportive in you working through and again, continue your education and becoming a medical assistant, especially with Nebraska Medicine. So we will try to work around, school schedules, and we have a lot of that. So, yeah.
Yes. And do you have any part-time openings, or are they all full-time currently?
I do have, I think we do have some part-time medical assistant opportunities available, and they come. So if anyone is interested in this medical assistant role, I can definitely talk to them, steer you in the right direction, and hopefully we'll accommodate.
Awesome, thank you. And you would say the easiest way to see the openings is visiting nebraskamed.com/careers and just searching medical assistant, and they'll all come up?
Absolutely.
Perfect.
And you can also search, if there's a specific area clinic, if you are only interested in Bellevue as opposed to main campus, you can also filter and search that way as well.
Great. And then there were a couple questions around shadowing. I know a couple MAs and managers had mentioned the opportunities to shadow. So is that available right now? And is that, a possibility for somebody before they accept a position with us?
Are there any managers who want to take on that question?
I can. So in pain, we have our staff, as a part of the orientation process, just shadow the providers when they go to the procedural areas to watch the injections. But right now, due to coronavirus, we are not having people shadow in the clinic before they would interview or hire. We used to, but just with all the coronavirus concerns, we are not allowing that at this point.
Thank you for clarifying.
And then the last really question that I have, and it's maybe a question for you, Alicia, or any managers, what would you say are maybe top 3 qualities you're looking for in a candidate when they're looking to apply for one of our medical assistant positions?
Absolutely. I'll address that. And then, of course, if any other managers want to add on. So, you know, with me being the talent acquisition recruiter and the first contact with anyone who applies, I am reaching out, and what I am looking for is that passion. Someone who not only has the experience in direct patient care, but also has that desire to continue to learn and grow in any position that we place them in or any clinic. But again, matching you with the right opportunity and the right manager. So definitely that customer service type demeanor. You know, you're passionate about what you're doing, you are passionate about interacting with our patients. And so it's just overall that personality that I'm looking for in a candidate.
I'd also just like to piggyback off of everything that Alicia mentioned, with the addition to dermatology. Since it's such a specialized area, we do not actually look for experience. We are willing and wanting to really train our medical assistants the dermatology way. And so we have our entire team as well as physicians who are completely dedicated to doing so.
Thank you, Tiara.
Hi, and I'll echo Tiara on that. We in cardiology are very team-oriented and willing to teach. So anyone that's interested in applying, we would definitely take the time to make sure that you feel comfortable with the steps that you're taking throughout your day and make sure you understand our process in full. We are also very much a team, so I'm really looking for a team player for our staff, and someone who's very self-motivated to do a good job and make sure that our patients are happy.
All right. And then I would just add again, you know, throughout the conversation I have with candidates, I ask questions about your previous work experience in general. So, you know, asking about when have you gone above and beyond for a patient, or when have you been able to provide a patient with a great experience, or even a customer if you don't have that previous experience. Also, teamwork, you know, what are some great examples of when you had to work within a team? Maybe when things didn't go so well, maybe when communication didn't go right, but how did you work through that process? And again, you know, is a candidate willing to compromise and problem solve to make sure, number one, the work gets done, the patients get what they need, and then again, how do you work within that team? And then also, how do you work with your leadership? You know, do you accept feedback? Do you provide suggestions of how to do something differently? And overall, how do you get along in that workplace? So that's just a little snippet of our conversation once you apply, and how we go about selecting our candidates. All right, if nothing else, no other questions?
There were just a couple of questions about location and where the clinics are, maybe what's all in the Durham Outpatient Center. So I don't know if you want to address that, or if you just prefer searching on the website and seeing location on there.
Yeah, that's what I was just going to suggest is the website. So nebraskamed.com, you can actually search the different locations. You can type in Durham Outpatient Center, and it will kind of list the various areas and services that we provide. And I just steer people back that way because once you get to the website, you'll kind of be pulled into all different pieces of information, and I really want to direct you there.
Great. That is all the questions I had then. Thank you.
All right. Well, thank you to all participants and our panelists. If you want to jump on camera so everyone can see your smiling faces again. And then we did have a prize drawing. So I wanted to introduce our winner tonight. And our winner is Sherelle Starks. So congratulations. I believe that is an Amazon gift card. And so congratulations. And if we can get your information, and we'll be able to get that sent to you. So again, thank you to all our participants. I call to action for you to go onto our website, nebraskamed.com, search, our different clinic locations, but also nebraskamed.com/careers to look at all of our opportunities. So I hope to be speaking with you soon.